Oh, you'll outgrow it. Just drink some water. Just use plain soap and water. Do those things sound familiar? Well, if you were a teenager with acne, you probably got this advice along with everything else all the time. If you're lucky, you would have left the skincare issue and its advice and its scars behind with your teenage years. But unfortunately, adult acne is apparently on the rise. Let's find out all about it from our resident GP, Dr. Donny Fick, and dermatologist, Dr. Rorisang Mathibe, who joins us for this very specialist conversation this morning. Gentlemen, thank you so much for your time this morning. When I told people and colleagues that we're talking about this, the questions are, oh, ask them about this. Can I show you this? Look at this thing on my stomach. You know, it's something that affects people and their families every single day. And that is why we have to have these conversations. Dr. Donny, let's start with you. And I always start with you because you're our first line of defense, the regular community family GP. How does acne and this very serious kind of skin issue present to you in your everyday work in your surgery?
I think as a general practitioner, this is the most common skin condition I get to see. Like, maybe the only dermatological condition I get to see. And it usually starts with teenagers. Usually, like, that was how it used to happen. Low confidence, they're coming in, they get bullied at school, they're almost depressed because of the acne, and then we need to find a way of managing it. But now, since COVID, I think we're seeing a lot of adult acne as well. Adults are like, my back, my face, my confidence, all of that is really low because of acne.
Dr. Mathibe, here's the big question. What causes acne?
Good morning and good morning to the viewers. Yes, acne, like my colleague said, it's one of the commonest conditions we see in practice, and it affects actually even infants. We've got infantile acne, we've got childhood acne, we've got adolescent acne, and even adult acne. So the causes are multifactorial, but it revolves around the fact that there is this unit in the skin called the pilosebaceous unit, where you find the hair follicle and a gland called sebaceous glands. So all of the stuff that are happening in there, the chemical mediators that are being produced, the sebum that is overproduced, eventually would lead you to having things that we call whiteheads, blackheads in our communities, even inflamed papules. So we would say there are associated factors, like diet now with recent data has mentioned that there are foods that we eat that can exacerbate your acne. The chemical we use...
What food that we eat that can make it worse?
So with the latest data, they have said that skimmed milk, low-fat milk has shown to cause or exacerbate the acne you have, and also high glycemic index food, like junk food, especially with high sugar, which is what we usually eat these days, has shown on data that there is a link, because there are certain chemicals that are produced in the body that will activate the glands that I'm talking about that you find in the skin called sebaceous glands.
Now, Dr. Donny, when you see somebody and you can see, okay, this is acne, what is your first port of call in terms of the advice that you're giving somebody who's presenting with acne to you?
Yeah, I think it also depends on the severity of the acne. So it depends, mild to moderate. I'm happy to manage as a GP.
And what kind of advice do you normally give in the mild to moderate or just the beginning stages of?
So there's a very important factor, and I feel like looking after the skin barrier first. Lots of people use retinoids, they use all sorts of face washes, but just maintaining and repairing the skin barrier with a moisturizing cream is so important. There's always been a myth that you should never moisturize acne because it adds to the oils, and you should use things that dry your skin out. So I'm like, my main focus is on repairing the skin barrier and protecting that with just a moisturizer and a cleaning routine. When we come to heavier medications, that's when we often go over to these guys. So I'm just simple maintenance, basic treatment, and if we're in trouble, then Rory will take over.
Dr. Mathibe, just this morning, I won't name any names, but in conversation with a colleague of ours here this morning, I thought was the perfect example of the myths that are out there about what you need to be using. And the response was, oh, I'm just using this well-known soap that's used in your day, in your kitchen, and that kind of thing. But you must hear that kind of thing all the time, and you want to pull out your insect. No, 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 don't do this. So what are the big don'ts when it comes to if you are trying to help your skin issue with acne at home?
Okay, so like you've mentioned, that there are many things we use thinking that they will work on our skin. And I have to say, even social media has made things worse now. So let's start with the myths that people talk about, with the fact that if you eat greasy food, it will make your skin, you'll break out,
Okay.
you know. If you have sexual intercourse, some even in the rural areas, they still have those beliefs that, oh, if you do that, it will probably clear your skin. So those are some of the things that we hear a lot from our patients.
And chocolate?
And chocolate is one of the food that falls under the high glycemic index food, like I've mentioned. So that can contribute a bit.
Okay, but it's not a massive...
No,
okay.
It's not. Especially the greasy food. I think the myth that is usually common, it's with the greasy food that we'll talk about. No, avoid greasy food, your acne will clear out. And that is not true. That is not true. Now, with the products that we use on our face, there are products that we call comedogenic products that people don't know about. And basically, comedogenic products are products that clog your pores. Remember I mentioned that acne results or involves the pilosebaceous unit, which is where you find the hair follicle. So there are products that we can apply on our faces, on our body, that clog those pores and exacerbate your acne. So I would say an advice would be, don't listen to people, don't listen to social media. Rather go and consult like my colleague and dermatologist and hear out which products can you avoid. There is no blanket approach as far as treating your acne or which products to use, because not everyone with oily skin has acne. Even people with dry skin do have acne, you know, and you cannot say I only have acne. You can even have acne and eczema. So now we need to use products that will even cover both conditions. So I think just follow the instructions from your health professional or a dermatologist to know.
But something that can be a very simple piece of advice is to avoid really hot water on those areas, to use, I heard you say, just lukewarm water.
Yes.
And don't use soaps that you probably are using to clean either your clothes or your dishes or that kind of thing. We're not going to name brands.
We're not going to name brands.
Yes. So look for a very mild soap that is for sensitive
gentle
skin.
Cleanser.
Yeah.
Yes, 100%. Hot water, not even just for acne, even conditions like eczema. You know, hot water removes all the nutrients that you find on the skin, all the oils that you find on the skin, and it will irritate your skin.
There goes the nice hot bath.
And that comes back to what we said earlier about maintaining the skin barrier. Like the moment you use you have hot baths, long baths, you dry out your skin.
You're taking all the joy away from us.
There's water loss in the skin that then breaks the skin barrier. Predisposes you to eczema, worsens your acne.
Now, Dr. Mathibe, let's talk about hormones specifically. Yes. I mean, I'm at one side of my life where hormones will start playing a major issue for other reasons. But there are different stages in our life. And with teenagers, hormones are a major thing. Is there such a thing as hormonal acne, or are hormones just involved in everything?
There is such a thing called hormonal acne. Let me put it in simple terms, like I've mentioned. I'm going back to the structure in the skin. The sebaceous glands respond to a hormone called testosterone. Testosterone is a hormone that when we get to our puberty years, it will be produced, and then this is why males develop beards, why you develop a heavy voice. And then we're not saying it's not found even in females. It's there, but at low concentration. But now, testosterone has the ability to activate the sebaceous glands to produce a lot of sebum. So that's where the hormonal aspect comes into play. But we also have conditions like PCOS, polycystic ovarian diseases, which are diseases known to produce a lot of hormones that will activate the sebaceous glands. And that is one of the associated factors with acne, that if you have those conditions, I'm telling you, there are patients that come to us with this type of acne, and then when we investigate, we actually pick up that there is ovarian cystic disease. So that's where the hormonal aspect actually comes in.
And again, another reason to go and see a specialist, because you just don't know what can be hidden under the surface, pardon the pun, because our skin really shows us everything that's happening on the inside. Now, Dr. Donny, since we started this a series of conversations, it really seems like we spend a lot of time speaking about mental health. But it's because our everyday health does impact our mental health. And acne, I'm sure, whether you're a teenager, whether you're an adult in your 20s, 30s, or 40s, acne must have an impact on your mental health. What have you been experiencing or seeing out there?
Definitely. With teenage kids, self-esteem, we mentioned earlier, bullying, dating, low confidence in those teenage years. But that also applies to people throughout their life. I mean, I read a fact this morning that there's a high percentage of women that still have acne into their 40s and 50s.
Sure.
But then you're just tired. You've had it since you were a teenager and you're now 50 years old. You're tired of acne. And I think one thing we need to say is that acne can't be cured. There is no cure for acne. If someone tells you they've got a miracle cure, they're lying. It just needs to be maintained and controlled with a good skincare routine.
Definitely.
Now, Dr. Mathibe, you have people coming in there, I've got acne, help me, but they're actually saying, I've got acne and it's making me feel a certain type of way. I've got confidence issues. I feel ashamed when I go out. I want to cover myself up with all kinds of makeup, which also is an issue. How are you dealing with that part of the issue?
People will be shocked. Let's highlight the fact that acne is a skin disease, and we need to approach it like any other disease. It's a multidisciplinary approach. From my side, I will cover the skin, but if you pick up the mental issues, the depression that comes with it, the anxiety that comes with it, the bullyism that our patients experience, you need then to involve other colleagues like a clinical psychologist to come and get involved and let's advise on how to deal with this depression, you know, because if we don't deal with the depression, they'll end up being suicidal. You know, you end up hearing people killing themselves because they feel unwelcomed by communities. You know?
And it's also not something that can be solved super quickly.
Definitely.
And I just realized the one question I probably should ask, because people want to cover it up. They don't want it to be seen because, you know, questions are asked or somebody looks at you funny. Women specifically, should we be covering it up with makeup until we are actually taking something to try and find a solution for the acne?
I wouldn't advise to cover it up. Let the skin breathe. Like I said, that we have products that are comedogenic, you know. Makeup is one of those products that will clog the pores. Now you will end up in that circle where you have acne, you're covering it up, but the covering makes it worse. You see, so we need to get to a point where let's just deal with the skin, let's use medication, avoid all these other things that exacerbate
it. So it's what you're eating, it's getting enough sleep, stress, I'm sure also involved.
Definitely.
And then failing all of that, try and go and see a specialist. If not a dermatologist, because we know they're pricey, start with your community GP who can send you in the right direction.
Definitely.
Anything else you'd like to add in terms of advice? Because we're helping the nation here.
Don't use the toothpaste, right? Don't use the toothpaste.
Okay, I will admit, as a teenager, I do remember there being 1 or 2 pimples, and I did put toothpaste on it. I did. Again, another one of those myths out there.
And I think be careful when you follow social media trends, right? Listen to the experts.
Definitely.
When I was researching our conversation today, one of the top searches on the Google search that they did in South Africa for acne was a TikTok story. I don't know what to call it. And it had a gazillion views. And it was a woman that claimed that she found a solution or cured her own acne within 6 months. And this is how I did it. It's so dangerous, isn't it?
Very dangerous, very dangerous. You can end up even damaging permanently your skin. And when you come to us, we tell you that, listen, this is the damage and there's nothing that we can really do about it. But if you had came earlier and then we caught it early, we can even avoid the complication associated with acne. Remember that one of the complications will be, especially in the people of skin of color, they will even be dealing with post-inflammatory hyperpigmentation, which is one of the things that will even affect their confidence. There's also scarring that can occur with acne. But the earlier we catch it, the earlier you see the right health professionals and we deal with it early, you will be able to avoid all these complications.
Okay, you heard it there from the expert himself, dermatologist Dr. Rorisang Mathibe, along with our resident GP, Donny Fick. Thank you so much, doctors, for joining us this morning. Very, very interesting conversation. And I do hope that we helped a lot of people, or at least set them on the right path. Put down the toothpaste, I suppose, would be the advice.